Hi, this is Dr. Valdes of ihcmiami.com and drvaldes.com. Today I want to tackle one of the most common questions that we get in our forums, and that is, what are thyroid symptoms? How do I know that I'm suffering from a thyroid disorder, whether diagnosed or undiagnosed? So here are some of the most common and most prevalent symptoms. The first one is dramatic fluctuations in temperature, either feeling too cold, feeling too hot, never feeling like you're right on the temperature that you should be. Also, hair loss, which can sometimes be continual for some women. Others, it can be cyclical. It can switch back and forth from hair loss to hair growth. Weight gain, this tends to be one of the most common and one of the earliest signs of a thyroid disorder when basal metabolic rate decreases. Some women experience as a yo-yo. Sometimes they'll experience it as putting too much effort and not getting the return they want. And some get to the point where it doesn't matter what they do, diet, exercise, they just cannot seem to lose that weight. Brittle nails and dry skin, these are also two very common symptoms of a thyroid disorder. Nails that break, nails that have lines across them, and also everybody should have a half moon on the base of the nail. Commonly, thyroid patients have no half moon at the base of the nail. Constipation, also a very common symptom. Depression, one of the most common presentations, sometimes misdiagnosed as major clinical disorder, depressive disorder, or bipolar disorder. For many women, it is actually their thyroid that's underlying the disease. Mental fog, what that means is just feeling like your brain isn't what it used to be, not being able to recall information as quickly, not feeling like you're as sharp as you once were. All of that can be a consequence of your thyroid also. And lastly, irregular periods, for which many women, this can sometimes become infertility and be one of the consequences of severe thyroid disease. And so why does this all happen? How are so many things in the body connected to one hormone? And the reason is that thyroid hormone, especially activated thyroid hormone, which is T3, is a master hormone in the body. What does that mean, Dr. Valdes? Well, this is a cell, if you remember from biology, and cells are full of receptors. Those are these little squares. And on the outside of the cell, we receive almost every hormone. So things like insulin, estrogen, cortisol, testosterone, all of these guys are received on the outside of the cell to trigger reactions in the cytosol of the cell. However, T3, which is activated thyroid hormone, is received in the nucleus of the cell. If you recall, in the nucleus, that's where DNA lives. So it is a DNA transcription and translation activating hormone. So everything comes from DNA. The keratin protein for your hair, the peristaltic proteins for your gut, the neurotransmitters in your brain, everything comes from activating DNA transcription and translation. And this is why a simple hormone can have such a broad set of symptoms in a person's health. So this is Dr. Ruben Valdes. Hopefully you found that information useful, and stay tuned to our channel for more information.